Chapter 18, this is our planning nursing care part of our nursing process. Okay, so the nursing diagnosis that you identify, the outcomes you hope to achieve, and the selection of individualized nursing interventions. So this is establishing priorities is simply telling you that whenever you are planning the care, we're going to treat that high emergent problem first, and then under that intermediate, non-life-threatening, and then low. So it really does follow Maslow's as well. So make sure that you refresh yourself on Maslow's. And priorities, they help you to anticipate and sequence nursing interventions when a patient has multiple nursing diagnoses and collaborative problems. This helps you answer the question that you asked to determine what will you do first. Okay, so role of the patient in the goal and outcome setting. Okay, we're always going to put the patient in the center of their care. Okay, for patients to participate in goal setting, remember too, this is important. So if we want them to participate in goal setting, they need to be alert, okay, and they need to have some degree of independence in completing activities of daily living, problem solving, decision making. They also need to understand the priority problems and have a willingness or motivation to resolve these problems. We need to get their buy-in. And unless these goals are mutually set with you and the patient, and there's a clear plan of action, patients may not completely or fully participate in the plan of care. And then that's going to lead to that suboptimal outcome. So patients need to understand and see the value of nursing therapies, even though they're often totally dependent on you as the nurse. Okay. So the difference too, I just want to interject here between goals and outcomes. And again, this is going to be something that in clinical you can talk to Dr. Landmark about, but essentially, so a goal is going to be patient-centered. It's not going to be an intervention. And then an outcome would be how would they achieve that goal. So let's talk about writing those expected goals. I think it's got outcomes at the top. That would be incorrect. So it's writing expected goals. So they must be patient-centered and they must be SMART. Okay, so this is an acronym you may already be familiar with, but I'll just go over it kind of quickly. So outcomes, they're what the patient will achieve, not what the nurse will do. So we need to be specific. Each outcome should address only one behavior, one perception, or physiological response. They should be measurable. So the nurses need to be able to measure or observe if change takes place in a patient's status. Terms describing quality, quantity, frequency, length, or weight allow you to evaluate outcomes precisely. They need to be attainable. So likely attainable when mutually set with the patient. This increases a patient's motivation and cooperation. So we want it to be something that they can attain. If it's not, you're going to lose their motivation. They also have to be realistic, okay? So can that patient realistically reach this? Realistic goals give patients a sense of hope. Okay, if we have anything that's not realistic, then they're probably going to lose hope. Each outcome is time limited. So the healthcare team has a common time frame for problem resolution. When does the outcome need to be measured? Okay, so a short-term goal is normally less than a week. So a short-term goal is an objective behavior or response that you expect a patient to achieve in a short time, usually less than a week. In an acute care setting, you often set goals for over a course of just a few hours or during your shift. So a long-term goal is an objective behavior or response that you expect a patient to achieve over a longer period. And we're going to say usually over several days, weeks, or by discharge. So time frames help you as the nurse and the patient determine if the patient is making progress at a reasonable rate. So it gives you something to measure. A patient is suffering from shortness of breath. The correct goal statement would be written as, Number 2, the patient will breathe unlabored at 14 to 18 breaths per minute by the end of the shift. Let's look at number 1. The patient will be comfortable by the morning. Comfortable is vague. We can't even measure comfort. Number 3, the patient will not complain of breathing problems within the next 8 hours. What does not complain mean? And number 4, the patient will have a respiratory rate of 14 to 18 breaths per minute, but it doesn't give you the when this is going to be. So types of intervention, these are different types. I do want you to know these: nurse initiated, healthcare provider initiated, and collaborative. So if we're talking about our nurse initiated, these would not require orders, okay? Would not. These can be independent action of the nurse, so they would not require an order or supervision or any kind of direction from others. Now, if we're talking about healthcare provider initiated, these would be dependent on that order from the physician. And then collaborative, that's where you're going to be working with people. Okay, so nursing interventions help the patient achieve the selected outcomes, is what they do. Nurse-initiated interventions require no order and no supervision or direction from others. And then according to the Nurse Practice Acts, remember this is for your state, in a majority of states, independent nursing interventions pertain to like activities of daily living, health education and promotion, and counseling. So what are some examples of independent nursing interventions? Elevating an extremity, providing patient education, showing how to splint when they're going to cough, holding a pillow if they've got an incision. Turning and repositioning are a nurse initiated, does not require an order from a physician. Healthcare provider initiated interventions require specific nursing responsibilities and technical nursing knowledge. Okay, each of these interventions requires nursing responsibilities and technical nursing knowledge. Advanced practice nurses who work under collaborative agreements with physicians or who are licensed independently by state practice acts are able to write dependent interventions. What are some examples of dependent nursing interventions? Inserting a Foley catheter or administering a medication. Again, types of interventions we're continuing to talk about. Don't automatically, you'll see in this bullet, but I just want to reinforce that do not automatically implement the therapy, but determine whether it's appropriate for those patients. Remember, you can't say any longer, I was following doctor's orders. You need to be accountable for what you do. So every nurse faces an inappropriate or incorrect order at some time, so just, be cognizant of this. I do want to have you write down page 246 and 247. Make sure you go home and review that box 18-1, please. So clarifying an order is part of competent nursing practice, and it protects the patient and members of the healthcare team. When you carry out an incorrect or inappropriate intervention, it is as much your error as the persons who wrote or transcribed the original order. You're legally responsible for any complications resulting from error. Even though you've planned a set of interventions for a patient, you have to exercise critical judgment and decision-making while delivering each intervention. Always think before you act. So under the selection of interventions, know that there are NIC, or Nursing Intervention Classification Systems, interventions that are linked with NANDA International Nursing Diagnoses, and this is all in your book as well as your Nursing Diagnosis Handbook. So we want to make sure that it is evidence-based and that it best suits our patient's individualized needs and situation. Okay, so you're writing a care plan for a newly admitted patient. Which one of these outcome statements is written correctly? It's number 4. The patient will identify the need to increase dietary intake of fiber by June 5th. So the first one it gives us an 80%, that's good. But it doesn't tell us when, by what time. And then nursing assistant will set the patient up for a bath every day. That's too vague. The patient will have improved. What does improved mean? We need that to be a number. Airway or some kind of measurable quality. Okay.